Paul Farmer is a monumental infectious disease doctor who works in public health, providing health care for the poorest people in the world. He co-founded Partners in Health and many other organizations that help elevate people out of poverty and disease. Paul Edward Farmer was born in North Adams, Massachusetts in 1959, the second of 6 children. His father, Paul Sr., who worked as a salesman and a high school teacher, moved with the family to Birmingham, Alabama when Paul was 7 years old. 5 years later, the Farmers moved to Brooksville, Florida, where Paul Sr. got a job teaching at a school and helping developmentally disabled adults. They bought an old, beat-up bus at an auction and converted it into a mobile home, replacing the rows of seats with bunk beds. The family fondly nicknamed it Bluebird Inn. His mother, Ginny, worked hard as a cashier and cared for 6 growing children in a bus, tent, house, and eventually a boat when Paul Sr. bought a 50-foot-long boat and tried, and failed, commercial fishing. One summer, when money was tight, they worked with Haitian migrants picking citrus. Paul was fascinated by the Haitians and their colorful language, Creole. This was his first encounter with the Haitians and would most certainly not be his last. Paul always excelled in school and was elected president of his senior class at Hernando High in Brooksville. He went to Duke University and received the Benjamin N. Duke Scholarship, which paid for his entire college education. At Duke, Farmer took medical anthropology, and after he graduated, went on to receive his MD and PhD in medical anthropology from Harvard Medical School in 1990. During his time there, he made frequent trips to Haiti, volunteering at a hospital in Conge, and returning for exams and other important events. Even though he didn't spend much time in Boston, he still got some of the highest grades in his class. After he graduated, he completed his residency at Brigham and Women's Hospital in Boston, where he would eventually become the chief of the Division of Global Health Equity. Farmer founded Partners in Health, PIH, in 1987, an organization that would provide health care for anyone who needed it, regardless of their ability to pay. He started as a one-room clinic in the remote town of Conge, but over the years became a complete hospital with a nursing school, operating rooms, satellite communications, and a blood bank equipped with incubators, a CT scanner, and an operating theater. Over the next decade, the organization built schools, houses, communal sanitation, and water facilities throughout the Conge area, offering their services for hundreds of what people paid in the U.S. They also launched programs for women's literacy and AIDS prevention, as well as vaccinating all the children in the area, which drastically decreased the infant mortality rate. Also receiving funding for bakery that reduced the malnutrition throughout the area. PIH arranged for 2.1 million home visits, recognizing that not everybody can make the journey to the hospital or hasn't the means. After PIH had established 16 medical centers in Haiti and employed almost 7,000 Haitians, PIH spread to Lima, Peru, to help them with their tuberculosis problem, as well as Siberia in 1998 when tuberculosis and MDR, a more dangerous, expensive, and harder to cure version of tuberculosis, spread into the prisons there that had people crammed together in cold, desperate circumstances. In 2014, PIH worked in West Africa to help tackle the Ebola and Zika epidemic that had taken over. Farmer believed in social medicine, meaning that instead of treating your patients only to send them back to the germ-friendly environments they got sick in, giving his patients food and other things they needed to stay healthy. When PIH was in Peru, 100% of the people who received food and other essential supplies were cured of tuberculosis, whereas only 56% were cured without the other supplies, proving that there was almost a double success rate when using social medicine. Farmer married Didi Bertrand in 1996 and had 3 children, Catherine, Sebastian, and Elizabeth. Farmer died in Butere, Rwanda, where he founded the University of Global Health Equity with Dr. Agnes Bingawahu in 2015. He was 62 and passed in his sleep from an acute cardiac event. Hundreds attended his ceremony in Trinity Church in Boston, and so many more tuned on for the virtual version. At the end of his life, PIH has spread to Haiti, Lesotho, Malawi, Peru, Russia, Rwanda, Mexico, and others, 12 different countries, helping those who truly needed it. He was the head of the Department of Global Health Equity and Social Medicine at Harvard Medical School, had written 12 books and over 200 scientific papers, and received the Berggruen Prize, Hilton Humanitarian Award, American Medical Association Outstanding International Physician Award, and the Margaret Mead Award. He drastically changed and saved the lives of so many people who thought things would never get better. He provided health care to some of the poorest people in the world and became the godfather to over 100 children. His work changed global guidelines on how to treat tuberculosis and HIV. Paul Farmer was an infectious disease doctor, but also a global health pioneer public health luminary, changemaker, and renowned humanitarian who's changed our Earth for the better. I chose Paul Farmer after reading Mountains Beyond Mountains by Tracy Kidder about the monumental work he did. I was fascinated by this guy and the massive impact he made. I feel like I have a better understanding of poverty and more educated than I was before doing this project. I learned so much and had a ton of fun.